Hi, this is our case called stiff knee with limited motion from stuck anterior glide of the distal femur at the knee joint. Lots of words, I'm stumbling over those words, but we'll show you the behavior of her knee. This is our interesting case, which is titled Sacroiliac Instability ? Sacral spring test injury in a medical student. And I'm Jerry Hesch with the Hesch Institute in Henderson, Nevada, close to Las Vegas. Our website is www.heschinstitute.com. So again, we're talking about her knee as part of this pattern. Stiff knee with limited motion from an anterior glide of the distal femur at the knee joint. So what I'm suggesting is that this long bone here is stuck forward down here at the knee. The day before yesterday, we actually treated the right hip joint, which had limited extension, and that has remained, and yet this femur continues to appear to be more forward. It's actually quite obvious to me. She has normative spring of the of the proximal tibia below the knee, very similar to this side. When I come up above the knee joint and I take up the slack, that has normative spring. This one I can't take up the slack, and I'm doubling the force and I'm tripling it. Can you tell that's more force than on the other side? She's nodding her head yes. Okay, and I just can't get any spring mobility. When we go to the midshaft of the femur, which is going to test more of the hip joint, you can see that her body accepts it and it springs and the whole pelvis moves when I do that. Let me just have you lie on your stomach and we'll demonstrate that your hip extension is still improved. So on day one, her right hip would not extend. The left hip freely would extend to 20 degrees. The right hip today easily springs to 20 degrees, or easily moves. I'm using the word spring, but wrong word, okay? Now there are some other subtle things about the knee that we should be able to test. We should be able to take it towards end range of flexion. It's taking a little while to creep up there. So once I get there, I'm going to stay about 10 seconds. And I feel like we just arrived at the end of her motion. And at this point, I want to give it a little bit of spring to test the end feel. It does bounce, but like a very thick block of rubber, and that's not what I would consider to be normal. On her left knee, we take it all the way, and the left knee certainly flexes much further. I'm about 4 fingers away from the medial buttock, and go a little bit more. It feels like I'm at end range now. And when I spring it, you can see there's certainly a lot more mobility. So we're at most, we're even less than, it's about 3 fingers from the medial buttock. Let's look at this one again. So now, look how far she is. Looks to me like probably 7 or 8 fingers away from the medial buttock. And when I attempt to spring it there, it moves, but it's just so limited. Would you lie on your back, please? The other clue that caused me to feel that the knee was blocked was testing end feel of hyperextension. Her left knee hyperextends. I can lift the heel perhaps an inch off the table. This feels the way that I would expect it to feel in a person of her age, gender, body type, etc. On this side, when I do it, it causes her discomfort and it just feels remarkably stiff. So what I'm going to do is support the lower leg below the knee and above the ankle, and I'm just going to impart an anterior glide force to the distal femur, because there are some rules of joint mobility, such as the concave on convex rule, convex on concave, and the reverse. But at end range extension, those rules can be relatively ignored. In fact, we violate those rules by inducing a posterior glide to restore the extension. And I would submit that these two bones, the femur and tibia, actually act much more like a point on a point, or a plane on a plane, much more so than a convex structure moving on a concave structure. In the last 10 degrees of extension, again, I submit that they're more like a point moving on a point. So we'll stop filming here, and I'm going to lean on that for at least 3 minutes, and then we'll come back and retest it. Thank you.